1 out of every 2 men and 1 out of every 3 women will be diagnosed with cancer. But despite those huge numbers, most individuals don't know what that really means.
Cancer statistics can sound shocking. 1 out of every 2 men and 1 out of every 3 women will be diagnosed with cancer at some point in their lives. These numbers are often repeated, but rarely explained. What do they actually mean? Does cancer happen suddenly? Is it one disease or many? And why does treatment work so well for some people, yet not for others? In this video, we're going to slow everything down and explain what cancer really is, using medical science, simple language, and clear facts. No fear, no exaggeration, just understanding. Because understanding cancer is one of the most powerful tools a patient, caregiver, or loved one can have. At the most basic level, cancer is not a foreign invader. It is not a virus or a bacteria. Cancer begins with our own cells. The human body is made up of trillions of cells, and every one of those cells follows strict instructions. These instructions tell the cell when to grow, when to divide, when to repair itself, and when to stop. Under normal conditions, this system works with extraordinary precision. Cells divide only when needed. Damaged cells are repaired or removed. Old cells die in a controlled way, so new cells can take their place. This balance is what keeps tissues and organs healthy. Cancer begins when this control system breaks down. Cancer cells are cells that have lost the ability to follow the body's normal rules. Instead of stopping when they should, they continue to grow. Instead of repairing damage, they accumulate errors. Instead of dying when they are no longer needed, they survive and multiply. These changes happen because of damage to DNA, the genetic material inside each cell. DNA damage can occur for many reasons, including aging, exposure to tobacco smoke, radiation, certain chemicals, chronic inflammation, infections, and even random errors that happen when cells divide. Over time, if enough damage accumulates and the body's repair systems fail, a cell can begin behaving abnormally. When these abnormal cells continue to grow and divide uncontrollably, cancer begins. When cancer cells multiply, they often form a mass of cells called a tumor. Not all tumors are cancerous. Some tumors are benign, meaning they grow slowly and do not spread to other parts of the body. Cancerous tumors are called malignant tumors. Malignant tumors are dangerous because they can invade nearby tissues and spread to distant organs. This process is known as metastasis, and it is responsible for most cancer-related deaths. Cancer becomes life-threatening, not just because it grows, but because it interferes with the normal function of vital organs. Importantly, cancer can occur almost anywhere in the body because cells exist everywhere. Breast tissue, lung tissue, colon tissue, blood cells, skin cells, and even cells of the immune system can all become cancerous. Some cancers are more common than others. In women, breast cancer is the most frequently diagnosed cancer worldwide. In men, prostate cancer is the most common. In both men and women, lung cancer and colorectal cancer remain among the leading causes of cancer-related deaths. However, it's critical to understand that cancer is not one single disease. In fact, medical science recognizes more than 200 different types of cancer, each with its own causes, behaviors, and treatments. Even 2 cancers that share the same name can behave very differently from one person to another. For example, a lung tumor in one individual may grow slowly and respond well to treatment. In another person, a lung tumor may grow aggressively and resist multiple therapies. This happens because cancer is deeply individualized. Each tumor has its own genetic fingerprint. Within the same tumor, there may be multiple subtypes of cancer cells, each responding differently to treatment. This is one reason cancer treatment can be so complex. Patients often ask, "Why did my tumor shrink, but not disappear completely?" Medical science has an answer. The cells that survive treatment may be biologically different from the ones that were destroyed. They may require a different approach. Once cancer is diagnosed, doctors must determine the stage of the cancer. Staging describes how much cancer is present in the body and how far it has spread. Doctors ask important questions. Where did the cancer start? How large is the tumor? Has it spread to nearby lymph nodes? Has it traveled to distant organs like the liver, lungs, bones, or brain? Cancer staging helps guide treatment decisions and provides valuable information about prognosis. Early-stage cancers are often easier to treat. Advanced-stage cancers may require more complex and prolonged therapy. Cancer treatment is not a single method. It is a carefully planned strategy designed to target cancer cells while protecting healthy tissue as much as possible. Traditionally, there are three primary cancer treatments: surgery, radiation therapy, and chemotherapy. Surgery works by physically removing the tumor from the body. It is often used when cancer is localized and has not spread extensively. Radiation therapy uses high-energy rays to damage cancer cells so they can no longer divide. Chemotherapy uses drugs that circulate through the bloodstream to kill rapidly dividing cells. Each of these treatments can be life-saving, but they also affect normal cells, which is why side effects occur. Chemotherapy, for example, targets fast-growing cells. Cancer cells grow rapidly, but so do cells in the hair follicles, digestive tract, and bone marrow. This is why chemotherapy can cause hair loss, nausea, fatigue, and lowered immunity. Radiation therapy can damage healthy tissue near the tumor site. Surgery can affect surrounding structures. The challenge of cancer treatment is finding the balance between destroying cancer cells and preserving quality of life. Modern oncology focuses on optimizing this balance more than ever before. One of the most important advances in cancer care is the understanding that treatment must be personalized. Cancer is no longer treated as a one-size-fits-all disease. Today, doctors can analyze the genetic makeup of a tumor through a process known as genomic profiling. This allows clinicians to identify specific mutations driving the cancer's growth and choose treatments that directly target those abnormalities. This approach is called precision medicine, and it has transformed cancer care over the past decade. Treatments that were not possible years ago are now extending lives and improving outcomes for many patients. Another important development is the integration of supportive therapies into cancer care. This approach is often referred to as integrative oncology. Integrative oncology does not replace conventional treatment. Instead, it combines standard cancer therapies with supportive practices such as nutrition counseling, physical activity guidance, stress management, acupuncture, and psychological support. The goal is not only to treat the cancer itself, but also to manage pain, fatigue, anxiety, depression, and other challenges that come with a cancer diagnosis. Medical research consistently shows that patients who feel supported physically and emotionally often tolerate treatment better and maintain a higher quality of life. Nutrition plays an important role in cancer care, though it must be approached responsibly and scientifically. There is no single diet that cures cancer, but proper nutrition can help maintain strength, support the immune system, and reduce treatment-related side effects. Similarly, lifestyle factors such as sleep, movement, stress reduction, and social support can influence how patients feel during treatment. These elements do not replace medical therapy, but they can make a meaningful difference in daily well-being. Science-based cancer care recognizes the patient as a whole person, not just a tumor. Receiving a cancer diagnosis can be one of the most frightening moments in a person's life. Fear of the unknown, fear of treatment, and fear of the future are natural responses. But it is important to understand that this is also the most advanced era in cancer treatment in history. Survival rates for many cancers have improved dramatically over the past several decades due to early detection, better therapies, and personalized treatment approaches. Research continues at an unprecedented pace. New therapies, including targeted drugs, immunotherapy, and advanced radiation techniques, are being developed and refined every year. Hope in cancer care today is grounded in science. Immunotherapy, for example, helps the body's own immune system recognize and attack cancer cells. This approach has led to long-term remission in some cancers that were once considered untreatable. Targeted therapies focus on specific molecular features of cancer cells, reducing damage to healthy tissue. Advances in imaging allow doctors to detect tumors earlier and treat them more precisely. While cancer remains a serious disease, the tools available to fight it are stronger than ever before. It is also important to emphasize that no two cancer journeys are the same. Each patient's experience is shaped by the type of cancer, its stage, the biology of the tumor, overall health, and access to care. Comparisons between patients are rarely helpful. What matters most is personalized care, informed decisions, and compassionate support. Understanding cancer does not eliminate fear completely, but it replaces confusion with clarity. And clarity empowers patients and families to participate actively in care decisions. Cancer is not a moral failure. It is not caused by weakness, negative thinking, or lack of willpower. Cancer is a complex biological process influenced by genetics, environment, and time. Medical science continues to work toward earlier detection, gentler treatments, and better outcomes. Each year brings new knowledge, new therapies, and new hope. For patients and caregivers, knowledge can be a source of strength. Understanding what cancer is and what it is not helps people navigate the journey with greater confidence and less fear. If you or someone you love is facing cancer, remember this: you are not alone, and there are more options today than ever before. Science is on your side, and progress continues every day. Education, compassion, and evidence-based care remain at the center of modern oncology. If this video helped you understand cancer more clearly, please consider supporting this channel. We are committed to providing science-based, respectful, and educational content for patients, caregivers, and anyone seeking reliable information. Subscribe to the channel for more videos that explain cancer, treatments, nutrition, and lifestyle tools in a calm, responsible, and medically accurate way. Your support helps us continue sharing knowledge that empowers and supports people around the world.